So I think you are very onto something when you said, I think it's my SI, I think it's nerve. What I pretty much just did is ran you through all the testing that is necessary to find out if it's disc or if it's a SI joint. The major difference is, and I'm just going to speak generally speaking, the major difference is that an SI joint right here does not typically enjoy or do well with extreme like compression, and it does not do very well with like shearing forces, which is like where we do, and it does not do well with extension especially. Whereas typically the disc, when you have low back issues and you're having nerve pain, it does a lot better with extension. So basically what I'm saying is if we do extension to the lower back and the SI joint,
like what you did here?
what I did, yeah, where it's like where you're on your belly and I did all those tests, if you do well with those, we're probably thinking back. If you do worse with those, you're probably thinking
Then
SI
why
joint.
does it hurt in my butt and below that area?
I think you're having a little bit of both. This is hard. This is what I'm saying. It's very difficult. And so I understand what I was saying before your inconsistencies. Because I think you're having irritation to the SI, but you're also having nerve issue. So, right, when I pushed down on your lower back, the extension, like you did really well. That last test, like the straight bending down, touching your toes, that was like a super easy test, but that tests and that pulls out the nerve. So interesting enough because you get more of the you get more of the spinal component and all like this like because you're rounding it this way, you're kind of like pulling up on the spine, then you're pulling down on the nerve, so you get a little bit of irritation there. But interesting enough, when I laid you on your back and I just did the nerve test, like just lifting the leg, I pulling just the nerve down, not the back, you had no issue there. If you had nerve irritation at its truest, like a true sciatica type of thing, you would probably have a lot more irritation with just that test. So that test would help definitively, not definitively, but with a lot more certainty on my mind, tell you what's going on. However, you did have a lot of SI joint irritation. Like that test that I said, like where we rotated you inward and outward, you're like, ow, that really hurt. And then when the one face upwards when I was pushing on your pelvis, and you're like, ow, with that knee bent, like that is a really good test for SI joint irritation, especially when I place my hand under there because we're creating that irritation. Yeah. So which one is it? Good question. I really can say, in my honest opinion, and this is very rare, and I say very rare because it's usually A or B with like a dominant of like, let's just say 90-10, but you were really like 50-50. Because some things are just really, really pissed off here, and some things actually do well here, and then some things are really pissed off here and do okay there. So if your back and your SI joint and this nerve pain goes down to here, and it is the elephant in the room, and there's two elephants, which one do we get rid of first? I don't know. I don't know yet. We're gonna figure this out though. The way we figure that out is we give you a set of a couple exercises and we do a couple treatments on you and we see what we need to do. And if you get better with that, we kind of decide on which is better. So here's the good news about this stuff, is that the way we treat low back pain in terms of manual work, in terms of what I'm going to do on you, is very similar. But in terms of your rehab exercise, we're going to have to decide, is it here? Or are we going to focus here? Because if you get better with, like, let's just say the exercise that we give you with the SI joint, congratulations. Then we know it's more SI joint involved. If we find out this is the one, then we kind of just focus on this. But if we focus on 50-50 on either one, and we don't know which one's hurting it, we don't know which one's helping it. So we got to figure out exactly. We got to stay with one exercise or one therapy that is actually going to work for you. What I'm going to be doing for you is going to be pretty therapeutic and healthy. I do think ice is going to help you because you are definitely having components of two. It's just that if you ask me personally, I think it's 50-50. If I had to decide right now, which I'm more than likely going to, I'm going to treat more of the spine first and see how that helps, because you do have some of that irritation.
Do you need to see like an x-ray? Because I have one. No?
I could take a look at it.
It might give you an idea because it is pretty messed up if you look at my
Yeah,
history.
I'll take a look at it, but I definitely want to kind of give you that insight though. But you're definitely having more tenderness with palpation touching on you, like right around there. But you seem to have a lot more therapeutic result, like when I was pushing on your spine, with a lot more relief of pain up through here. So it's like, I think at this point, in terms of giving you an at-home exercise to calm things down, I think I'm going to focus on the spine, and then we'll see if that makes it feel better after a few days, or a couple days, and if that's the truth, then great, we'll run with that until it calms down. Then we could focus on, spine and hip, but we can't do both. Otherwise, we're gonna be very confused on how to treat it. Because if you treat this is pretty much going to conflict with this, and this is going to conflict with this. So it's like you got to treat just one at home. We can treat both in the office, but we got to treat one at home, and so we know exactly what's going on. Okay. Does that make sense to you? Any questions on that?
No.
I had a case like this recently.